morning, good afternoon, good evening from wherever you're watching, and welcome to another episode of Something About Surgery. 2 weeks ago, a patient caught me off guard when they asked if I would be willing to stand as a witness in court because she wanted to lodge a case. And that got me wondering, how many patients actually know what to do in the event they feel aggrieved by a healthcare provider? And today I want to talk about an important document around that area that was released by the Ministry of Health in 2013. It is called the Patients' Rights Charter. This is a brief document that has got 3 segments. It has a segment on patient rights, and there are 14 of them. It has a section on patient responsibilities, and there are 15 of them. And it has a segment on dispute resolution. Now, speaking about patient rights, they are numerous. You'll be surprised. The right to be informed of what you're suffering from, the right to an informed consent, which is something we've already spoken about, the right to be informed about what your insurance cover entails. Did you know that? The right to seek a medical opinion, a second medical opinion. And speaking of medical opinions, I have seen patients struggle to voice it, that they would want to seek a second opinion. They think I will feel belittled or insulted or slighted. Yet, seeking a second opinion is a universal patient right, not just in Kenya, but world over. But related to this case is actually the other right, which is the right to complain. The Charter espouses and recognizes the importance of the patient being empowered to complain. So next time you feel aggrieved, you actually have the right to complain to the relevant office in that hospital, or even to the patient or to the healthcare provider directly. Of course, you might not feel like your interests will be taken at heart, but I know most institutions have departments to make sure that they handle all patient complaints and address them amicably. And that takes me to the 3rd segment of that charter, which I'm going to attach as a comment to this video for you to read through. And that is on dispute resolution. What does the document say? It says there are 3 areas or 3 avenues that a patient can utilize if they have a grievance against an individual or a healthcare provider. One is to lodge that complaint directly with the concerned party. Tell them, I feel aggrieved because of 1, 2, 3, 4. And then from there, move on. And that institution or hospital or healthcare provider will listen to you. If it's the institution, the relevant public relations office or client relations office or customer care office will listen to you, and hopefully these 2 parties will come to an amicable solution. If that doesn't happen, there's another option, and that is the patient may complain to the relevant regulatory authority. For instance, if you are aggrieved by a surgeon, or you want to lodge a complaint against a surgeon, then the regulatory authority for surgeons is the Kenya Medical Practitioners and Dentists Council. And there is a procedure on how to lodge the complaint there. And once you've lodged it, that council will pick the complaint and follow the usual processes and procedures and inform you of the decision. And finally, there is the 3rd option, and that is in a Kenyan court of law. A patient can lodge their complaint in a court of law, and the court again will initiate the relevant processes and procedures to listen to the case in question, to determine and make a ruling and judgment. Please take a moment to go through that document. It is just 20 pages long with a lot of appendices, meaning it is shorter than that. And let me know what you think about the responsibilities, the rights, and dispute resolution. Of course, you can leave a comment, subscribe, and follow, and I will be more than happy to address any comments. Thank you.